Hello, Lucy, is it?
Yes.
Hello, my name's Chester, please. Okay, step in 2 seconds.
Yes.
Yeah, thank you. Yeah, not a problem.
I'm going to put you in the back seat over here.
Hold on, man. So
Yes.
get the seat up.
Okay, just take a seat in there for me, Lucy. I'll move that seat forward a bit. Shortly.
Yeah, I just had knee surgery. So.
Oh, right, okay.
Only a small number of people know what Dr. A looks like. For those who've been following the Lucy Letby case, one theory put forward by prosecution and echoed by some casual observers was that Lucy Letby sabotaged babies because she was desperate to see a doctor who would rush to the nursery after hearing alarms for calls and help. This idea seems possibly beyond reason or comprehension, but we'll see once we get into it whether that's true or not. A more plausible way to view Dr. A is a peripheral figure connected to Lucy Letby allegations. Another explanation, one that carries greater public interest, is that there may be an individual who intentionally misrepresented both evidence and the nature of his relationship with Letby, essentially burying his mistress while trying to protect his own family. This is significant because the thorough inquiry has been reviewing the events at the Countess of Chester Hospital from the summer of 2015 to the summer of 2016, with the goal of identifying what went wrong and how to prevent similar tragedies in the future. If this anonymous Dr. A did distort information during the court case, it could also have misled that public inquiry. Recent media coverage of the Letby case has questioned the statistical and medical evidence that implicated her in some or all of the deaths. The Daily Telegraph reported that the bacterium Pseudomonas aeruginosa was detected in the neonatal unit during the period of Letby's alleged killings, and quoted microbiologist David Livermore, who described how hazardous that bacteria can be. These findings have revived scrutiny over infectious control practices at the hospital. At the time of the incidents, Dr. A was a married registrar, 17 years older than Letby. Before her first trial, he applied for a court order preventing his name from being made public, explaining that his son was sitting GCSEs and his daughter was taking A-levels, and neither was aware of his involvement in the case. As a result, he gave evidence from behind a screen. It isn't entirely clear whether the relationship with Letby was intimate or purely platonic, but there's a striking contrast between the tone of their text messages during the period of the time of the incidents and how the doctor later described their relationship in court. By reviewing the surviving text messages, it becomes clear that Letby and Dr. A were close. Their exchanges suggested warmth, mutual admiration, and a degree of dependency, though the exact nature of that dependency remains open to interpretation. During the months in question, their messages were frequent. They discussed daily routines, cases on the ward, hospital gossip, and personal matters. Colleagues noticed their report. One message from Letby to Dr. A read, "You're such a great friend," to which he replied, "I'm only great because you make me feel it." There were moments of teasing and light flirtation, though neither explicitly acknowledged any romantic relationship. Their friendship deepened during stressful periods on the neonatal unit. Both worked long hours and were emotionally invested in their patients. It was not unusual for staff members to form strong professional and emotional bonds in such an environment, particularly when faced with repeated critical incidents involving infants. However, as the investigation into the unusual number of deaths began, the same closeness that once seemed innocent took on a different tone in hindsight. When questioned in court, Dr. A appeared eager to downplay the depth of their relationship. He described Letby as a friend and a capable, diligent nurse, but insisted there was nothing beyond a professional connection. Observers, however, noted a certain defensiveness in his testimony. Prosecutors referred to him as the object of Lucy Letby's affection, suggesting that her alleged actions were partly motivated by an emotional fixation on him. The defense, meanwhile, suggested that his portrayal was both inaccurate and unfair, implying that Dr. A may have minimized his personal involvement to protect his reputation and family life. What further complicated matters was that Letby herself appeared deeply affected by him. After she was removed by clinical duties in 2016, text messages revealed distress, sadness, and feelings of rejection. She confided in friends that she missed working with him and that she felt isolated and lost. Meanwhile, Dr. A reportedly distanced himself. Colleagues later recalled that he became tense and guarded whenever her name was mentioned. His previously easy rapport with Letby vanished after her suspension. The tone of their earlier messages, though subtle, contradicted the restrained image he projected in court. Whether this shift was driven by guilt or fear or genuine discomfort remains uncertain. What is clear is that Dr. A's statements to investigators painted a much more detached picture than their earlier communications would suggest. As the inquiry prepares to properly revisit the case, the contrast between the private messages and the official narrative will likely attract renewed attention. Understanding the true nature of Dr. A's relationship with Letby, whether it's a supportive colleague, a close friend, or something more, may prove crucial to determining how the hospital's internal culture and personal relationships influenced the handling of the neonatal deaths. Court reports indicate that Lucy Letby and Dr. A exchanged messages that appear professional but occasionally personal. For example, in March 2023, messages revealed Dr. A offering guidance on routine procedures and expressing support for Letby's actions with patients. Letby responded with gratitude. In some instances, Dr. A offered practical assistance, such as helping with lunch arrangements or providing transportation to and from the hospital. Letby sometimes declined or joked in response, suggesting a casual or platonic interaction rather than evidence of an attention-seeking motive. Letby also discussed Dr. A with colleagues, noting that she did not fancy him, describing him instead as a nice guy. This reinforces the interpretation that the relationship, while friendly, was not necessarily romantic or manipulative. By June 2016, Letby had been moved from clinical duties to administrative work. Text exchanges from this period show Dr. A offering assistance after Letby fainted and providing support with hospital processes. Later messages indicate further casual interactions, including meeting for coffee, meals, shopping, and trips occurring between May in June 2017. During cross-examination, Letby acknowledged having a boyfriend during the period she was on administrative duty, but did not name the individual. Court reports note that Letby referred to Dr. A as a supportive figure, including messages in which he called him her best friend. The prosecution suggested that Letby's alleged actions were intended to attract Dr. A's attention. This theory was partially based on a testimony from Anthony Yuko, who stated that Letby sometimes involved Dr. A in clinical situations. However, the evidence from the text messages suggests Letby did not manipulate Dr. A for personal attention. He frequently offered help, and Letby often declined or responded non-romantically. The timeline shows Dr. A became involved in the court case months after Letby's alleged incidents began, which weakens the theory that her actions were directed at him. Some experts link this attention-seeking theory to Dr. J.Y. Evans, who has a controversial history of diagnosing Munchausen by proxy. Critics argue that Evans sometimes misinterpreted genuine medical conditions as attention-seeking behavior. The comparison highlights that medical opinions on motive must be interpreted cautiously. Dr. A was called as a prosecution witness, despite prior texts showing support for Letby. During his testimony, he described clinical concerns, including incidents where babies' blood sugar levels dropped during night shifts. He explained that low glucose levels in infants could lead to seizures or brain injury. The insulin test results used in the Letby case have been questioned by forensic toxicologist Alan Jones, who argued that certain amino acid-based tests can sometimes produce anomalous readings. Joseph Waldorf, a pediatric hypoglycemia expert at Harvard Medical School, also noted potential irregularities in insulin testing. Freedom of Information Act request examining Liverpool hospitals from 2020 to 2023 found mostly normal insulin results, though a few unusual readings were observed. The case included allegations regarding nasogastric tube insertion. The prosecution, citing Dr. J.Y. Evans, suggested that some injuries could result from deliberate harm via a nasogastric tube. Dr. A testified that he had difficulty with tube insertion in at least one case in child N, noting that such complications are uncommon but can occur. Comparisons of nasogastric tubes and intubation equipment show that endotracheal tube placement requires a laryngoscope to manipulate the epiglottis, a small structure at the back of the throat. Studies indicate a first attempt success rate of roughly 80% in emergency settings, meaning failed attempts are not unusual and can affect patient outcomes. Dr. A's testimony at times appeared to deflect responsibility from his failed insertion attempts and align with the prosecution's theory, though he had previously stated in a 2018 police statement that he was unsure if the bleeding was caused by his actions. Dr. A also discussed concerns about possible infection in one infant. He described a septic screen blood culture that reportedly ruled out infection. However, clinical studies indicate that culture-negative sepsis can occur in 28 to 49% of patients, meaning a negative test does not fully eliminate the possibility of infection. Medical defense witnesses, including Dr. Michael, later suggested that infants were sicker than portrayed in court.
He thinks the babies were actually far sicker than the prosecution portrayed.
Text messages from Dr. A during the period reveal discussions about patient conditions, including the possibility of viral infections, and challenges interpreting post-mortem results. In one case, a liver injury identified in autopsy was likely caused by CPR, according to the pathologist. Text messages show Dr. A discussing this with colleagues, but during court, his memory reportedly went blank, which coincidentally supported the prosecution's interpretation of events. Dr. A described Letby as having unrequited affection toward him and mentioned that his wife had also experienced attention from Letby on social media. This section preserves all key medical and procedural facts, including Dr. A's statements, insulin test reliability, nasogastric tube complications, sepsis testing, CPR-related injuries, while keeping the tone neutral and factual. Text messages between Dr. A and Letby suggest a cordial, sometimes supportive relationship, with Dr. A offering advice and assistance in clinical matters. There's no clear evidence in these exchanges to support the theory that Letby intentionally harmed patients to attract his attention. During the trial, the prosecution raised the possibility that Lucy Letby engaged in attention-seeking behaviour. This theory appears to have been influenced by the testimony of medical analyst Dr. J.Y. Evans. Overall, the available evidence doesn't conclusively support the notion that Letby acted to attract Dr. A's attention. Dr. A's testimony, while central to some prosecution arguments, shows areas of inconsistency and potential selective emphasis, particularly regarding medical complications. A careful, fact-based review of texts, clinical records, and expert analysis is necessary to form an objective understanding of events. If you're still with me, don't forget to drop a like and subscribe. Stay well, stay safe, and I'll see you soon.